Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast. Hello, welcome everyone to our next edition of our Destroying Diabetes podcast. I'm Dr. Keith. I'm glad that you could join us again today. And like I said, I guess I'm still able to do it. They haven't locked the doors on me. They hadn't hidden anything from me. So they let me in and kept the microphone on. So I guess I'm doing good for another week. So I'm always aware that they may lock me out and turn my mic off and say, get off the air, but it hasn't happened yet. But I'm glad to all of our listeners to have joined us. We're getting like a tremendous feedback. Keep it coming. Keep the emails coming with questions. I've had some suggestions for some future podcasts, and I definitely will keep those in mind as we're developing future episodes. So again, I'd just like to thank everyone that supports us. Just want you to continue just to like this podcast, follow the podcast, give us a review, hopefully give us a 5-star review, and just promote it to your friends and family. Anybody that has an internet connection can get this podcast. So you don't have to be in North Carolina or even in the United States. I'm still waiting for my first international listener to send me something. I haven't had that yet, but and I am so grateful for this podcast. We've been trying to get together for the longest time, and I'm finally glad that we've gotten together. And I really appreciate her. This is a real star. This is not like me, somebody that's just yapping at the gums. This is someone that is an expert. I have just a tremendous amount of respect for her, what she's done in the medical community. I think her career story and just her career tangent is so fascinating, and she's all over the place. So if you got an internet connection, any kind of social media page, just follow her. I'm glad to welcome Dr. Nicole Swiner. She is the superstar in this area. So if you want to know anything about medicine, if you're someone that's an entrepreneur, you want to get good advice from somebody, or somebody to really follow, someone that knows about wellness, someone that knows about self-care. This is person. I'm so glad that she's been able to take a few minutes out of her busy schedule to enlighten us today. So I'll just have her introduce herself, and then she can go from there. Again, thank you for being on the podcast today.
Absolutely. And thank you. Thank you for keeping me accountable and say, hey, remember now, we were going to do that podcast. I was like, girl, you're right, we're going to get it done. So this is my fault that it's taking this long, or I'm going to blame my family or my kids and their schedules too. But can you hear me okay, by the way?
Yes. Mm-hmm. Yeah.
Excellent. So I am Dr. Nicole Swiner, and I am very happy to be here with my friend and colleague, although I think this may be the first time we've actually met, like, quote, in person.
Okay.
We have followed one another. You know, I've watched you with your journey and trying to support all that you were doing, particularly here in the Durham community, with keeping our folks healthy and tell them all the right things about medications and how to get off medication, all that good stuff. So I commend you and thank you for the work that you're doing as well. But he was very gracious in saying some things about my career that are not all true. I'm not necessarily a superstar, but I do my best. I do my best in terms of advocating for, particularly for the Black community, for women's health, for mental health. And I, at my core, am a family doctor, and that's what my training is in. But I've done a couple of different things in research and starting some wellness companies and all that. But at my core, I'm a family physician, and I just want the whole family to be healthy and have a good quality and quantity of life.
Yeah, well, thank you so much. And she's being modest here, but she's She is. Then I'll say it's my words that you're a superstar. You're not saying stuff, but they've been
Well, thank
in
you.
my thing that superstar. And just like I said, really appreciate this. If you're gonna follow someone on social media, Dr. Swiner is definitely someone that you will benefit from following. Like I said, I follow for years. So
I
ever since
appreciate
I've
that.
opened up the pharmacy, everybody's like, "Well, you got to meet Dr. Swiner." And I've had some of her patients in the past, and they've always raved about her because I was like, if I have to call about something or get the refill, they're like, "Well, you doctor, it's like Dr. Swiner. She is just wonderful. Oh, she'll refill it. All you gotta do is tell her hello, and she'll get it done. No problem. Or if you need to change something." Oh, she'll do it. She'll do it. She's great. She'll do it. So I've always said so. The purpose of this podcast, one of the biggest questions I get, and I'm sure that you probably get it as well. Now is with our new generation of diabetic medications. This particularly the ones that are the quote unquote weight loss drugs, ones that you see blasted all over TV, Ozempic, Wegovy, Mounjaro. Those are probably the big three. Those are probably the things I have the most questions with, as far as diabetes medications now. And then of course people take it outside of diabetes as well. So, but especially my diabetic patients, that's probably the number one question I have now. So what I wanted to do today is invite her on. We can go over basically, first of all, what are these drugs? How do they work? And then we could talk about some of the benefits, and then there's also with benefits, there's also a few drawbacks as well. So if someone was asking, and I'm sure that this happened with you in your practice, is like if they ask, what are these? I see these things on TV about Wegovy and Ozempic, and people said that they've lost this weight, and I've had like celebrities giving testimonials about how much weight loss they've done. That what are these drugs? How do they work? What about them?
Yep.
What would you tell us?
Yes. So it's a huge topic, particularly controversial topic because there are pros and cons, of course, of being on these medicines. And then there have been a lot of obstacles that have creeped or crept up recently in order for people to get it. So just to kind of start off, so we all know what a challenging disease and chronic long-term issue diabetes is, right? We probably have either personally been affected by it, or we are a caretaker of somebody dealing with it, or we have a friend or a close family member that is dealing with diabetes. Horrible disease, affects multiple parts of the body. And when it comes down to it, it's about reducing your intake of sugar and helping your body to monitor whether it's, decreasing its production of sugar or helping us to get rid of the sugar that we're putting into our bodies is the main issue that diabetes causes. And if you don't deal with those sugars, or if you're overweight or you are obese, it makes it harder to control. And then you get all these organ damage issues, right? Kidneys, liver, brain, all these, heart, everything. So diabetes is a huge problem. What the first thing that I usually will answer when people ask me about these new weight loss injections is to say, well, you realize that they aren't necessarily new. Like this, the mechanism of action is not new. We've had these shots around in different names for probably at least a decade. And you probably know this even more than I do, Dr. Keefe, right? And so if you go way back to the Victosas and the Byettas, right?
Yeah.
That's where it first started. So was it about 10 years ago that stuff started coming out? Yeah. So I remember the pharmaceutical reps coming into the office and telling us about this new technology that you could use that, you could treat diabetes with doing a shot. And we were like, oh my gosh, that sounds great. So a lot of people don't like to have to swallow 3 and 4 pills 2 and 3 times a day. If you can just do one weekly shot, that would be really convenient. Victoza, Byetta, these medicines were coming out. We were learning about them. I'll be honest, I was trying them, because we'd gotten some information that they also help to reduce weight, right? So they're great for blood sugar control. But then in the data, it was showing, oh, by the way, these patients are also losing weight. And oh, by the way, these patients are also having good cardiovascular outcomes. So I was like, okay, this is, these are great drugs. So I would try it out. I had 2 kids and was trying to monitor my, diet and exercise and lose a little bit of baby weight. So I tried it. And then lo and behold, they came out with Sazinda. Sazinda was essentially the same medicine that Victoza and Byetta were. Correct me if I'm wrong, Dr. Keith.
No.
Right?
Nope.
The generic from those and remarketed it as Sazinda specifically for weight loss, right? A lot of us have forgotten about that because it was so long ago.
Yeah.
Right. Fast forward to now, Ozempic was kind of the big one to show up first for treatment of diabetes. That then, oh, by the way, look at the weight loss that the patients have benefited from, 30 and 40 pounds coming off without them having to really struggle, because a lot of diabetic patients are, of course, overweight or obese. Not all of them, but most of them. So if you treat the weight issue, you can treat the sugar issue. And so because that was happening and they were seeing such a significant amount of weight loss, the pharmaceutical companies were like, oh, so we can now develop this into something specifically for weight loss. Here comes Wegovy. Guess what? Wegovy is exactly the same thing as Ozempic, just a different name, right?
Yep.
So now it's being marketed as this weight loss drug when really it came out to treat diabetes, right? So you have to understand that too. So that's how this pharmaceutical game works. You prescribe a medicine for one thing, you see that it benefits in other ways. So the companies then take that, remarket it. They may reformulate it in a different way, 1 or 2 molecules of a chemical, remarket it, and now it's just for this other thing. That's how the game works. The good news is these medicines actually do work, right?
Yeah.
And so long story short, I went the long way around to come back to the conclusion is these medicines have actually been in some form or fashion, they've existed for a long time. It's not new news that they've helped people lose weight. And they've been remarketed from a diabetic drug now to weight loss drugs. Mounjaro, now on the market, is soon to be called Zepbound, which is the same thing, but Zepbound is going to be the thing that is marketed specifically for weight loss. I'll pause there.
No, okay. Yep. Everything that you said is exactly true. And then like I said, that a lot of times what happens is that sometimes in a good way, when you have drugs come to market, then you find something that may be actually beneficial than that wasn't found during the trials and stuff. And that was the case with all of these and stuff. And now we got big time marketing and brand name changes and adjust the molecule here and there, and then and just rename it and rebrand it so so they could continue to make money off of it. So yeah, so that's exactly true. And that these agents that they kind of I wouldn't say they kind of take advantage of our biology to help with the control of blood sugar. They kind of operate to cause our body, just to put in the simpler terms, that cause our body to process and get rid of blood glucose more efficiently than what we would normally do. And also because of that being lowered, then the side effect is that you have, a reduction in body weight and body fat. And so that improves everything else. So it's it's a very effective product, and because it's been out for a while, so unlike a lot of other new drugs, it's actually been studied, a lot more than other things, even though they have new names. But the
Yeah.
drugs themselves have been out for a while, and they've been studied in clinical trials. So that they can feel confident in remarketing and changing a few molecules here and there, and did not have to be so concerned as much about the safety profile because they have been studied a great deal.
Exactly. Exactly. So yeah, so this whole, this group that we're talking about, the GLP-1s have become hugely popular and popularized now in media and social media. The more that the celebrities are talking about it and what helped them to lose their weight and all that. But I mean, and I've talked to a lot of my colleagues and friends about the usage and usages of these medicines, but also the stigma that is attached to it, which is an interesting thought. So if you think about it, because the majority of diabetics often have to deal with being overweight or obese, if we treat obesity and being overweight, which a lot of us feel should be its own medical, like chronic medical issue and diagnosis and condition, obesity, if we treat obesity, we can treat a million other health conditions that happen because of it, right? So why is it that there's such stigma attached to people using the medicines really only if it's to lose weight, when obesity itself should be its own medical condition? So there's been a lot of shame attached to people. I don't know, either shame that they put on themselves or shame that we project onto people that are using these medicines for weight loss, because, oh, you're taking it away from people who truly need it. You're taking it away from the diabetics, and you're taking it away from people that actually need it because they need to protect their heart from heart issues related to diabetes. And now they can't get it because you're using it just, for cosmetic purposes, just because you want to look a certain way. That's not the case. A lot of folks have had struggles. Even when you have diabetes or high blood pressure or something that is affected by your weight, and you should have a healthier weight to help control, there's a lot of struggle and challenges that people deal with. People try all kinds of things, and it's hard to lose weight once you've hit a certain mark.
Mm-hmm.
And if these medicines help you, I call them the liquid lap band.
Yeah,
That's what I call them.
yeah.
If they help you to have a healthier weight, we all know that BMI matters. I know we have our own thoughts about what it means to have a healthy weight, but BMI does matter. And if these liquid lap band medicines help your stomach to feel like literally it's smaller, like you can control your intake, lose weight, have healthier outcomes, why is there such stigma attached to that? So that's a lot of the conversations I've been having recently, is trying to help the public not make people feel ashamed for using these medicines if it's actually helping them, even if they don't have diabetes.
Yeah.
It's treating their weight and helping their obesity improve, or help them to not be obese at all. That actually has really great outcome, long term. So that's a lot of the conversations we've been having.
Yeah, and now because I guess so much has been done and publicized about it. Now the most of the major drug manufacturers now are ramping up really their production. So some of those and some of the reps have come in and said like, well, I know with Ozempic that they've gotten the supply, um, you know, really ramped it up, working 24 hours a day, gotten it up. That's probably the one I've seen the most improvement on as far as supply. Wegovy still, um, and I think because most of their manufacturing is done overseas, so that one is still, that's probably the worst one. Monjaro is probably, they're sort of in between those two. Ozempic, I think there's kind of got this act kind of straight now, but Wegovy is way behind. Monjaro's kind of in between.
Yeah.
But hopefully,
right?
yeah.
They're gonna have to get it better.
Yeah. And plus, it's so much money
Right.
spent on the table by not having it done. So,
Right.
so So, and then especially if you're like, Monjaro or you're Wegovy and Ozempic, it's getting theirs out there. Guess who the doctor's going to start writing their prescriptions for?
That's right. Yep.
So that issue is it's improving. A year ago, it was awful. You couldn't really get in. Couldn't really hardly get anything last year. I probably get maybe at least 5 phone calls a day. I used to get maybe about 10 or 15 about especially like Wegovy. And Wegovy is still they're the worst. They're the farthest behind. And I don't know, and I can't really tell that. And I'm telling the truth, when I tell the patient, I don't know when it's going to be back because my wholesaler's like, don't even ask us. Right? It's like they just got long-term back order. Don't even ask us when it's coming back out. Because some of them, they say like, well, they expected 30 to 60 days or 90 days. It's not like that with Wegovy, but
right.
but I'm also glad that we should try to release the stigma now that the supply issue is becoming less. I understand it more when the supply issue was, and it's still challenging. But a year ago, it was awful. A year ago,
yeah, it was. It was.
As soon as I got in, it went right back out. So then it went right back on back order. So.
And I'll share this real quick, not to interrupt you, but my husband has been very vocal about his diabetes. So he has diabetes and he's doing his best to control it. And his doctor put him on Ozempic. And it was during all this time when all this stuff was happening a year ago with being challenging to get and hard to get. And I transitioned jobs, so our insurance changed. So on one insurance, we could get it for $25 or so, no problem, when it was available. But then when I had a gap, in switching insurances with a new job, there was a time we were paying out of pocket for meds, or actually I think I had a short time where I purchased my own insurance for a short time. And then, the coverage wasn't as good as when I was working the job. So then when we put in the prescription to get the Ozempic that time, the bill was going to be like $1,200. And I was like, no, like we got to find alternatives. So we had to switch it back to like metformin for a little while and then try to get, like, it's crazy. So I'm glad to hear it's getting better.
Yeah. And so now does it kind of just to kind of summarize now some of the challenges with it? What would be some of the challenges with these drugs?
Taking these meds? Yeah. So, all medications, not everyone is in the appropriate population to take these meds. There are some reasons why you probably shouldn't be on these medications. Number one, you should definitely always have your certified medical provider be the one to prescribe them and talk to you about them and monitor you while you're on them and checking your labs. So don't get them off the street. Don't take your friend's supply without having a good talk to your doctor specifically about the uses of them, because they do have some potential complications. One thing that is helpful is if there's a particular type of thyroid cancer that if in your family history is prevalent, you probably should not be on these types of injections. So you want to be careful about that. If you have kind of what we call brittle diabetes, where your blood sugar can drop and spike out of nowhere, you want to be very careful with these meds because they work so well that if you're prone to hypoglycemia, you want to be very careful because you don't want your sugars to drop too significantly. But the most common side effects are probably gastrointestinal or GI. So, nausea, vomiting, diarrhea, abdominal pain, constipation. Those are the things that a lot of people deal with when they first start taking these meds. Some people improve over time as they're on them, but some people just can't tolerate them at all. So you want to, be aware and be cognizant of those things before you start the drug.
Yeah, definitely. Probably, like I said, that's definitely the number one side effect of it, because the way that it works and helps suppress your appetite. But also the thing about that is that it can disrupt your GI. So nausea is probably the biggest thing with that, and diarrhea. Those are probably the two biggest things that I've gotten from my patients from that. and it does feel good, especially like first when you first start, and then especially as you go up on dose. Like when you titrate to the higher dose, usually that's you usually experience it most like when you first started, and then usually when you first titrate to like if you have to titrate to a higher dose, then you feel it. Um, but um, but the
Yeah.
thing is that if you're able to tolerate it, I have to tell the like in time frame because like I said, you know, give it like a month or two. Usually, most people cases as your body gets used to the medication. Usually, a lot of times that and that dosage, your body gets adjusted to it, and usually those side effects subside. But if it's too intolerable, then like I said, then you may have to use something else because if you can't, if you're throwing up or you have constant diarrhea and it's for not more than for a month or so, then then you probably just
Healthy.
have to try something else. Yeah, yeah, you just have to try something else. But and then the thing what you talked about, probably the other thing is that, and that's one of the things that I have to deal with on my end, that unfortunately that these drugs are very expensive.
Right.
They're so expensive that I'm sure you've seen this too, that the state health plan is saying that they're not going to cover the drugs anymore because of the expense.
Right. And is that both for diabetes and weight loss, or is it just for the weight?
Well, they're saying like they say definitely like weight loss. So basically, you're going to have to like if you have diabetes, you probably have to get like a prior off even with that. But
Gotcha.
but they're not going to cover it for just weight loss anymore. And that's why I say, and then a lot of people and then like I said, if your insurance is not as good or you have a high deductible plan, then, that's like one of the things I try to tell patients before they go on, especially if I'm aware that they're on one of those type of plans it's pretty expensive. You still may end up, and I've had patients end up with, $300 or $400 even with
Mm.
decent insurance. Um, Okay, so well, I really appreciate you coming on. And if there's anything you want to say, like in closing statements,
Yeah.
before we get out of here.
I just appreciate you having me on. And, if you have any questions about health, wellness, self-care, women's health, even though I'm no longer in the clinical setting, I'm still available to help, be a health advocate and answer questions. So, please reach out, shoot me an email or a DM via social media. On IG and Instagram is probably the one I use the most. I'm at Real Doc DOC Swiner is my last name. Real Doc Swiner on IG. So reach out if needed.
Yeah, and definitely, I said this is a lady you need to follow. If you're in those areas, I really appreciate you coming on. That we've gotten together, and I just wish you continued success. And like I said, I'm a big fan, and I'm just gonna
Likewise.
keep on following. And thank you so much for coming on today. And I appreciate everyone listening. If you have any feedback or if you have any questions, just email us, and I'll pass them along to Doc Swiner, and we can get them answered for you. So thank you for listening, and continue to be well.
Thank you for joining us on this informative journey. The content of this podcast is solely the professional opinion of the host for informational purposes only. It should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you're experiencing any health issues or concerns, we strongly recommend that you seek the counsel of a qualified healthcare provider before making any changes.